A local hospital accused of neglect and abusing patients,
including one man with Parkinson's disease and dementia who ended up with scrapes, bruises, and sores.
As Michiana's problem solver, Kevin Warmhold, discovered, it's a Mishawaka location facing serious allegations from one of its former employees.
I served this country for 4 years in the Marine Corps. Then I worked the streets of New York with the NYPD for 17 years. Now I'm here to serve you. I'm Kevin Warmhold, and I'm Michiana's problem solver. What happens behind closed hospital doors with patients who no longer have an ability to communicate clearly or call for help? Who is watching over the staff reporting allegations of abuse and negligence on behalf of those patients? After learning of a hospital along the St. Joseph River with a troubled record, I went looking for answers. Warning, some of the images you will see could be disturbing.
Neglect, abuse. He was going to die.
They have no empathy towards anybody, patients, staff, no one.
Start at the very beginning, just start laying out what exactly happened and why you contacted us.
So I had gotten a phone call from my sister.
Candace Greene says her father, James, had fallen out of bed and had to go to the emergency room. He'd been recently diagnosed with Parkinson's disease and dementia. After James was evaluated, a doctor told Candace the only hospital in the state of Indiana that could help her father was Medical Behavioral Hospital located in Mishawaka, which specializes in treatment of patients with serious psychiatric events or neurological disorders. On April 13th, Candace drove through the night to get her father the help he so desperately needed. She came upon this path covered by trees and brush. This path, she told me, was the path that led to her heartbreak.
I feel terrible that I'm the person that drove him there. You know, I had no idea what I was taking my dad to. I was just following a doctor's order.
Candace claims her father was abused, neglected, and not properly medicated while in the care of Medical Behavior Hospital. James was a patient between April 13th and May 12th of 2022. Days after being admitted, he took his first of 2 trips to the emergency room.
He was going into renal failure because he was dehydrated, he had not had any food, and he was not getting his medication.
2 trips by ambulance to the hospital here at St. Joseph Regional Medical Center. The second time James was brought here was because he fell out of his bed. Now, Candace informed me that she was told by hospital staff at MBH that he fell out of his bed because the bed rail was left down.
He needed that bed rail up, and to not have safety measures, that led to him going to the emergency room. I was not prepared for all of the injuries that I would see on my father's body, or the amount of weight he had lost in just the few days that I had not been there.
Before leaving St. Joseph Regional Medical Center, Candace tried to keep her father from returning to the care of Medical Behavioral Hospital, but was denied by St. Joseph Hospital staff due to a doctor's order from MBH. After James returned to Medical Behavioral Hospital, Candace tells me his condition continued to deteriorate.
I saw the care firsthand that they would give the patients, and it was horrifying. So I knew that they weren't taking care of him.
Candace says her dad lost weight, was left in soiled clothing with urine and feces, and had bed sores.
They looked at the bed sore, and it was just completely oozing green pus. It hadn't been taken care of at all.
She also claims
my father had been punched in the face. When we asked about the, being punched in the face, what happened, they really didn't have an answer for us. They just told us that he got hit by another patient.
Candace took these pictures, she says, to document the awful treatment her father was receiving. Candace filed an official complaint with the Indiana Department of Health and Human Services, and she received this response. At the time of the Indiana Department of Health's investigation, the facility was found to meet our requirements under the Hospital Condition of Nursing Services. I reached out to the executive director and the CEO of Medical Behavioral Hospital to find out about Candace's dad. Their lawyer informed me they cannot confirm or deny James was ever a patient at the hospital. We confirmed through this document provided by Candace, James was a patient. According to records obtained by ABC 57 News, the Indiana Department of Health and Human Services investigated Medical Behavioral Hospital in Mishawaka for an unrelated incident that took place in January of 2022 and found a staff member allegedly punched a patient in the face 8 times and choked him. Section 4 of this report substantiates the complaint and refers it to the Attorney General's office. The investigation didn't take place until 3 months later in April, and there was no way to know if the employee accused of this abuse still worked at the hospital when James Greene was a patient from April 13th of 2022 to May 12th of 2022. I requested the conclusions of any reports forwarded to the Attorney General's office from the Indiana Department of Health. This was their response, citing, "The data you requested is not being disclosed to you because it may be part of the investigative records." I talked with an ex-employee about these type of allegations, and here's what she observed firsthand during her shifts at the hospital. Fearful of retaliation, she asked that we hide her identity. She worked part-time to cover shifts at Medical Behavioral Hospital in Mishawaka because of staffing shortages.
It would be fair to say that if somebody were complaining that their family member that was a patient there wasn't being changed or cleaned on a regular basis, that would be a fair assessment.
There would be days where, I mean, there could be weeks that somebody doesn't get a shower because there's not enough staff to get them a shower. You would have one tech, one aide to 22 patients for the day.
Did you ever observe patients with bed sores?
Oh, yes.
She went on to say that she believes Medical Behavioral Hospital is focused on turning a profit. The ex-employee says she left because she was miserable working for MBH. I reached out to Dr. Laura Mosqueda, the director for the National Center on Elder Abuse, to get a better understanding about abuse, neglect, and exploitation in hospitals.
Now, has there been enough studies into elder abuse in a hospital setting? And what are some challenges that somebody who would be looking to do an investigation into a hospital setting, what are some challenges that they face?
Lots of challenges with studying this. Many of the people who are victims of abuse or neglect have cognitive impairments or are in vulnerable states, so aren't able to really communicate clearly or aren't believed once they do. Another issue within hospitals is it's hard to go and measure abuse and neglect.
I asked Dr. Mosqueda if bed sores on a patient are always the sign of neglect.
There's no specific time frame I can give you because, pressure sores are when there's damage, basically death to the skin and the tissue under the skin, and it can be so severe that it goes down to the bone. Now, that sounds horrible, and it is horrible. And sometimes it happens despite good care or adequate care, and sometimes it really is signs of neglect.
As for Candace, after spending 30 days at Medical Behavioral Hospital, her father was finally released, only to pass away 8 days later. Candace believes it was the hospital's fault.
I feel terrible that my father had to endure 30 days of torture and abuse and then lose his life due to medical negligence, I believe.
Candace is hoping that this story could bring change over the lack of oversight neuropsychiatric hospitals receive. Indiana has a healthcare facility complaint program through the Indiana Department of Health, but that may not be enough. Your best course of action may be seeking legal advice, given the amount of paperwork and privacy laws in place. If you have a problem and you want me to look into it, you can email kwarmhold@abc57.com. In studio, Kevin Warmhold, ABC 57 News.